So maybe you've heard that sometimes hearing aids can improve tinnitus. That is true, but how do you know if you have a hearing loss that hearing aids would help? And how do you know if hearing aids are going to help your tinnitus? In this video, we're going to dive into those questions. This is Pure Tinnitus. Hey, my name's Dr. Ben Thompson, audiologist and tinnitus specialist in California. This video is number 2 out of 7 of the 7 strategies to control your tinnitus. Now, this is coming from an ebook that I wrote, which I included for free in the description below. I strongly recommend having this resource so you can be best equipped to live your best life with tinnitus. The second strategy you should try if you have bothersome tinnitus are hearing devices, also called hearing aids. Now, this would only be relevant if you have some symptoms of hearing loss. Those would be having a hard time hearing your friends and family, having to often ask others to repeat themselves, having difficulty watching the television, turning the volume up, or noticing some progressive clarity loss in the quality of speech, as if people have been slowly starting to mumble over time. I'm a doctor of audiology. That means I have the most extensive training with hearing aids. So let me share some of the secrets and top tips you need to know about hearing aids for tinnitus. This strategy will touch on some of the same basic principles as strategy 1, sound therapy. In your auditory brain, you have tinnitus. That comes from your cochlea, the hearing organ, not processing sound all the way through to the auditory brain. So what that means is there's a lack of input of sound into your auditory system. That means you're hearing a quiet world compared to what you used to. Therefore, when we increase sound in your environment, then the tinnitus isn't going to be so loud. When you're wearing the devices during the day, around 50 to 60% of people report relief from their tinnitus. Basically, the hearing aid is giving your auditory system access to the sounds that your cochlea, your hearing organ, was filtering out. So that means if you have a hearing loss, putting on hearing aids, things are going to sound louder. You're going to notice a lot of different hearing ability and acuity in your environment, with your family, with speech sounds, television volume, etc. The fact is that 80% of people with tinnitus have some degree of hearing loss. So if you have not got a hearing test yourself, I recommend considering that. Hearing aids are sophisticated devices, and there's millions and millions of dollars of research going into them. Right now, there's no pill or surgery to make it completely go away. So hearing aids are often a great choice about how to manage the tinnitus during the day. Simply wearing the hearing aids in their normal setting will improve the tinnitus for a lot of people. Additionally, you can consider what are called ear level noise generators. This is usually a setting of the hearing aid that you can access by pressing it, and that will give you some calming sounds to wear through your day. If you haven't already, make sure you click that free ebook, The Ultimate Guide to Tinnitus Relief, 7 Strategies to Control Your Tinnitus, where all of these details of all of these videos in this series are laid out as a guide for you. The potential benefit from some of these ear level sound generators would be similar to what you would experience with sound therapy during your day. The difference is that you're going to hear this sound only in your ears, so no one else in the room or no one else around you can hear it. What that means is that you can play relaxing white noise, you can play relaxing ocean noise, nature sounds, other kinds of specific tones that have been set up for tinnitus relief. You can be listening to that in your ears at a low, soft volume during the day, and you won't be bothering anyone else. That is a big deal. There's some cases where I did use ear level noise generators that looked like hearing aids. They essentially were, and they were fit on patients who didn't have a diagnosed hearing loss. That is a common treatment method in tinnitus retraining therapy. It's not for everyone, but it is something to consider if you don't have a hearing loss. Ear level sound generators could provide some relief for you. If you haven't already, make sure you give us a thumbs up for this video, because if you don't, YouTube won't recommend our video to anyone else. Press that red subscribe button so you get our new tinnitus education video coming out every single week. And of course, tap that notification bell, because if you don't, YouTube won't let you know when it is released. My name is Dr. Ben Thompson. This is video number 2 out of a 7-part series, The Ultimate Guide to Tinnitus Relief, 7 Strategies to Control Your Tinnitus. Thanks for being here. It means a lot. And remember to take your tinnitus journey one step at a time.